first off, as far as, again, I want to welcome everybody here. Sovereign Health, dual diagnosis, eating disorder programs. We have also the Sovereign Academy, and we also work blended programs because every individual is a little bit different, and we have to understand that just case by case. That's not always dual diagnosis. Sometimes there's triple, and even more once you get the underlying things. But we're here to help, and we're growing. And also, too, I want to let everybody know that even though we are growing, we still have that one-on-one mentality that we really want to take care of our patients and really understand them and work as well as possible with them. So, without further mention, Amanda and Beth is going to talk about our NAD program.
Thank you. Hey guys. I think most of you have already heard the presentation I did for the interns. So some of you I think already heard that presentation, which was much more long and boring. So I'm Amanda, this is Beth. We started doing research on the NAD program. I started about 4 months ago, and I went and trained in New Orleans and got certified by the company that actually patented this treatment. And Beth came on about a month ago, and she's been training really hard and studying the program and treatments as well. So just really quick, I'll go ahead and let Beth tell you what NAD is and what it's used for and who it's used for.
Okay. NAD is a coenzyme, and what we will be doing is we'll be going through an IV, and once it's entered the body, it's then metabolized into niacin. The niacin works on the same receptors as any type of addictive substance, so your alcohol, your benzos, your opiates. And what it does is it attaches to those receptors. So when a patient is detoxing, let's just say off of heroin, what it does is it'll make the transition from them coming off a whole bunch of heroin. It helps the detox. So by day 4 of their treatment, the treatment lasts about 10 to 14 days. By day 3, day 4, their withdrawal symptoms are nearly 50 to 70% decreased. So if it's 100%, they'll only be feeling about 30% of their withdrawal symptoms. And right now, we'll be giving it to people who are addicted to alcohol, benzos, speed, anything like that. Eventually, once we get that under our belt, we'll be giving it to people who have chronic fatigue. We'll be giving it to people who have depression or PTSD, because they found it actually helps those patients as well. But here at Sovereign, for the first 6 months, we'll be giving it to people who have addiction, substance issues.
So yeah, she's absolutely right. It's very amazing. The NAD goes into the brain and it just bathes the brain in nutrients, which essentially creates the brain restoration process, which is why the program is called Brain Restoration Plus. It restores your brain cells to their previous function in just a mere 10 to 12 days, which in a normal detox on a normal patient would take months, sometimes years, to receive that same effect on the brain. These people leave probably more mentally clear than me and Beth by the time they leave the treatment. They're just completely restored in every single way. They claim on the 4th or 5th day feeling like a click, like they can see more clearly, they feel mentally clear, they want to go do things, they have energy. It just completely restores you to 100% energy and mental capacity. So it's pretty great. These people don't have to get on any addictive substances. We do it all natural. And then the greatest key points of this treatment are that the NAD, once we start giving it to you, your withdrawal symptoms are cut in half. You're not going to have the same withdrawal as a normal withdrawal. Normal withdrawal is very bad, and even sometimes you have to lost them. With NAD, sometimes patients barely even feel a withdrawal. It's like nothing compared to what it normally would be. The other thing that's great is that by day 10, all patients that have been tested and had the treatment report 0 cravings on the craving scale for their drug of choice, which is, as we all know, the biggest reason for relapse. People crave their drug, even though they're physically non-dependent. They crave their drug, they crave the high, they want to be on their drug of choice. This eliminates that completely because the NAD fills those gaps in receptors in their brain and tell them that they don't need that substance anymore because they're full of another healthier substance that's making them feel even better. So that eliminates the need for the cravings, and then on top of that, you got your brain restoration process going on as well. So it's kind of like a trifecta of just really great things. It's the healthiest way to detox, I would say. And then I think you guys, just from hearing that, can see why it's different than any normal treatment. At this point, we only accept private pay, so we're doing our own little private pay, and then insurance companies do reimburse up to half, I think, just for certain things. But we just wanted to give you guys a quick rundown of that. We really appreciate the chance to come up here and do this. And if any of you would like a tour of our clinic, it's Suite 150, right around the corner here. We're going to be waiting in there, so after this presentation, you're more than welcome to come in there. I can give you guys some research. I can give you our phone number. You guys can have anything you want. So I appreciate you listening and giving us your time, and thank you very much. So, yeah, I hope you enjoy the rest of your day.
Awesome. Welcome, everybody. Thank you so much for coming. I'd like to introduce Dr. Mark Filidei is an internal medicine physician and is the director of integrative medicine for the AMEN clinics. Integrative medicine brings together conventional medicine and with complementary and alternative therapies. Dr. Filidei's approach to find the root cause of a person's health problems, including metabolic, genetic, and environmental factors that and to treat those problems in it as a natural way as possible by using targeted nutritional supplements, correcting hormone and metabolic imbalance, improving lifestyles and diet, detecting and treating toxin exposure and infections. At the heart of AMEN method is the understanding that in order to effectively treat the brain, you must treat the entire body. As an expert in the field, he advises not only his patients, but also physicians as well. Dr. Filidei received his undergraduate degree in physiology from the University of California, Davis, his medical degree in UNT Health Science Center in Texas, completed his internship at Tulane University and his residency in internal medicine at the Ivy League's Brown University. He is also on staff at UC Irvine as an assistant clinical professor of medicine, and he teaches medical students and residents. Once again, please give a warm welcome to Dr. Filidei.
Well, thanks for having me here. I hope to show you some kind of interesting and intriguing medical and biological things that can affect mental health. So, you know, at AMEN Clinics, of course, our number one motto is, you don't know if you don't look. Hence the SPECT scans and looking at internal issues as well, infections, hormone imbalances. So we don't want to just, you know, send people on a lifelong course of drugs when they don't need them. We have to use this cool touch screen. So you probably have heard of this recently, but psychiatry really does need a new direction. Of course, the Bible of psychiatry is the DSM. Well, the director of the NIMH just came out and said it's bunk. A lot of psychiatrists are a little upset about that, but it's really true that there really is no science there. So he said that the NIMH will no longer fund studies based on DSM criteria. This was just a few months ago. Click. And this is really true. The weakness is this lack of validity. So unlike other areas of medicine, the DSM is just based on clusters of symptoms. The doctors literally gather around a table and vote in new diagnoses. How many believe in road rage disorder? Okay, done. Vote. And that's really, there's also mass avoidance disorder. Who doesn't have that? That's great. It's really some silly things in there. So, this is true. Patients just need, they need better options. They deserve better. So the biomedical model, this is actually not a new topic, but it's a totally new take on it. The biomedical approach was initially that you have a chemical imbalance. Right? This is the drug rep story when you tell your patients they have a chemical imbalance. Take this drug. So that it was based on drug model. The new biomedical model is actually based on data, on science, metabolic parameters, which I'm going to cover here today. So it's a whole different biomedical approach. So core principles. Everybody's individual. So you have biochemical individuality. We are not all the same. We have different genes. We have different environment. We all react differently. That's really taking a big place in medicine now. It may actually be malpractice in a few years to give a medication if you haven't done a gene test, because certain drugs are metabolized differently in different people. That's why some people have horrible reactions to drugs. Other people tolerate it just fine. We actually use a test called Genomind, which is a psychology-based gene test that looks at how you metabolize psych drugs. So you might not be a good candidate for an SSRI if you have a certain genetic modification. You don't want it, it could be dangerous. And that goes for many drugs. So that's, again, part of this whole idea. It's patient-centered, not disease-centered. I'm talking about the person and not the disease that they have. Big difference. You got to balance internal and external forces. So that's the 4 circles, aim and approach, where you have biological, social, spiritual, etc. All taken into account. And then this is kind of where I specialize, is this familiarity with all the interconnectedness of internal physiology. The toxins, the hormones, the diet, a big deal. And again, another really key, oops, gotta get used to that. A really key, not works when I want to, point is normal is not necessarily optimal. That's really key. That's why so many patients are walking around hypothyroid, blatantly hypothyroid, but their doctors say their tests are normal. So normal and optimal, not the same thing, especially when it comes to hormones. We'll talk about that later. So again, optimization, not pathology. Big difference. So it's a different kind of work, a different approach to medicine. I will ask, different questions of patients that no normal doctor wouldn't ask. We use a lot of advanced testing. It's not even heard of in medical school. There's a whole field of tests that are available that you just don't know about. Most doctors don't even have the availability to use. And we rely on cofactors, supplements, vitamins, again, biological stuff that helps treat the problem. Drugs are not the first line of therapy. It should be the last choice. You go to Dr. Raymond, we're talking about this in the specials. You got to look at all the other issues first and then use drugs when appropriate. And you have to look, of course. So I will be thinking when I see a patient, and I want other doctors to think this too, and patients too, is mercury causing your anxiety? See if it works now. Is mold causing your insomnia? Which it can. Is low thyroid the cause of your depression? And not a Prozac deficiency. Estrogen dominance causing your PMS. Boy, this is a big one. Candida overgrowth. This can cause so many problems, including mental fogginess, aches and pains, just so many things that are diagnosed as psychiatric problems. It's actually a physical problem. Bacteria, Clostridium bacteria has been shown to contribute to autistic behavior in kids, actually even in adults. So you can have bacterial overgrowth in the gut causing mental illness. We'll see some more evidence of that later on. So let's just take, this could be one patient with all of these things. Irritable, fuzzy thinking, anxiety, insomnia. I mean, you see these all in single people. It could be one person with each of these separately. Waking up in the morning, 2 and 3 o'clock in the morning. So now you could treat all of these things medically, and you could give them an anticonvulsant, mood stabilizer for the irritability, some Provigil to speed up their brain, a little Xanax, never hurt anybody, right? No problem. Ambien, never hurt anybody, so easy to use Ambien, get on Ambien or not. Ritalin for their attention, you go on and on, some Zoloft, some Vicodin. If you're a man, you can use Viagra. If you're a woman, we can't do much for sexual problems, except maybe read 50 Shades of Grey. Hard to put that in the pill. So you could do all that, or you could treat candida that's causing all of those problems. So for instance, candida causes all of those problems. How do you know? If you don't look. So the gut-brain connection, really important. This is the whole bacterial environment in your intestines. It's a big deal. And it's finally coming out in scientific literature how important this is. There's actually a prescription probiotic now that doctors can use, which was unheard of just a few years ago. So this actually functions as a metabolic organ in your intestines. You have all this billions, trillions of bacteria in your intestines that are producing things that your brain needs, that your body needs. So it really functions as an organ and can affect cognition, personality, mood, eating behavior, all kinds of neuropsychiatric diseases, again, which aren't. It's because of the gut imbalance. So I have a whole lot of tools available to look for these things. Again, you gotta look, right? That's the key thing here. So I use a stool analysis test, immune function testing, look for heavy metals. Mercury we're going to talk about here in a minute. Heavy metals can affect mental function dramatically. Adrenal function, is your body detoxifying properly? Maybe you have a genetic problem with detoxification. It's actually very common. So toxins build up in your system, drugs build up in your system. You don't get over medications quickly. You have a tough time getting off of medications. That lasts a little bit. And of course, hormones are really important. So here's an example of the stool test that I do. Again, doctors don't do this. If you go to Kaiser, you're not going to get this. If you go to a gastroenterologist, you're not going to get this. They're really missing the boat on this whole bacterial issue. So it tells me the good bacteria, the good bacteria that you want a lot of. Now NG, you said, means no growth. That means there wasn't any good bacteria. So this is a problem. There was also 4+ of this Klebsiella, a real bad guy. No yeast grew, but there was yeast found, many yeast found on the microscopy. So this person has a big problem in their gut. You also look at digestive and absorption parameters. Are they digesting well? Do they have inflammation in the gut? And another immune system check for the gut. Of course, it checks for parasites. Now, doctors do stool tests, but it's usually just for parasites. That's not enough. And then when I do find something, it tells me what to use, both prescription and natural, to treat. So you can have all these things going on: stress, infection, problems in your diet, low stomach acid, toxins, and they lead to this leaky gut syndrome. You may have heard of that. It's a real entity and a real big deal. Having that leads to food allergies. I don't actually do food allergy testing for a couple reasons. One is they're all inaccurate. None of them agree, so I don't know which one's right. Number two, if you have leaky gut syndrome, whatever you're allergic to will go away if you fix the gut problem. So it leads to food allergies, malnutrition, toxin overload, and you get this huge burden of toxins in your system, which leads to systemic disease. So here's what leaky gut syndrome is all about. This is like inside your lumen, inside the fold of the intestinal lumen. Here's the cells, and here's inside your body. So this is outside world, this is your barrier, this is inside your body. So you obviously absorb nutrients through this barrier. That's how we get all our energy, and food is absorbed there. It's supposed to go through the cell, but not through these tight junctions very much. There is something called paracellular uptake, but it's really for liquids, and it's a tight junction. So what happens is that junction gets damaged, and now stuff leaks through here that's not supposed to get in. That's called leaky gut syndrome. And why that's bad is that you get things that aren't supposed to be in your body go into your body, and your immune system has to get rid of that foreign invader. That's inflammation. So it's an inflammatory reaction, which is bad. So why is the gut so important? Well, if you think about it, it's our biggest barrier to the outside world. You would think that your skin would be, here's me and here's outside. This is not me, this is me. So So your skin is certainly a barrier, but it's not that big surface area-wise. It's about the size of an umbrella, more or less, a few square meters. Your lungs, which have all those little tiny sacs in there, again, inside and outside world, you're breathing the air in from the outside world, about the size of a singles tennis court, so it's way bigger than your skin. Now the bowel is the size of the entire tennis court. It's the biggest area exposed to the outside world. So that means your immune system has to patrol all of that. You have zillions, trillions of white blood cells protecting all that area. So if you have an autoimmune disease, the key word is immune, whether it's lupus, rheumatoid, whatever, and you have leaky gut syndrome, your immune system is now compromised. That's why the gut is such an important area. It's a huge interface between us and the outside world. So if you have a problem there, how do you fix it? You got to do the test to find out what's there. Reduce the inflammation by getting rid of the bad guys. Change your diet if you have gluten sensitivity, if you're eating junk, which hinders your immune response, your digestion. You got to fix that, get rid of the sugar. And then mucosal support. So you take probiotics, you take glutamine, which helps the intestines heal. So you can fix the problem is the key. Now, let's look at these symptoms. So mood swings, memory loss, muscle weakness, impaired cognition, irritability, nervousness, insomnia, even excessive shyness, headaches. This is kind of like all the people you see at some point in time have some of these or all of them. So what could tie all those together? Mercury causes all those things. It's a big deal. Mercury is in the environment, particularly in fish. Larger fish, salmon are not that bad. Tuna, shark are the worst. Swordfish, the worst. And even the EPA, which is pretty conservative, says pregnant women shouldn't eat more than one piece of fish more than twice a week. Avoid swordfish and albacore tuna altogether. Everybody, they're saying, should avoid albacore and swordfish, not just pregnant women. And those silver fillings you have in your mouth, guess what? They're not silver. They're 50% mercury. There was a big battle back in the 1800s. There were two dental associations. One of them said, we shouldn't put mercury in people's mouth. That's poison. The other one said, no, it's fine. It's cheap. It's safe. Guess which one won? The other association was dissolved. So they're still using it to this day, which is ridiculous in my opinion. 50% mercury, some silver. There's also tin and copper in there. So every time you chew, drink hot liquids, you're actually inhaling mercury vapor. And it's not good stuff. You've all heard of the Mad Hatter, right? Mad Hatter. The Mad Hatter in Alice in Wonderland. Well, it's a real deal. It really happened, and happened back in the 1800s. There were workers that made hats. They made felt to make hats. They turned fur into felt by using mercury salts. And they absorbed the mercury into their system, which is a neurotoxin. So it causes anxiety, panic, depression, tremors, irritability, just the kind of, if you can imagine someone just turned up to the nines, just anxious, jittery, that was a poisoning, but you can have those exact same effects with chronic exposure from fish, from fillings. Particularly for some reason, I see a lot of this in women more than men. I don't know if they're more susceptible to mercury, but that's one of the first things I check when there's a high anxiety level in a patient, mercury. And so they were hatters. They made hats. They went mad, hence mad as a hatter. So you can check for this. So here's a person that has, I've never seen a mercury level this high. I've done thousands of these tests, but you could, again, check for it. You know, it's off the scale high. You check all the other toxic metals as well, like aluminum, etc. But mercury is a real bad player. The best way to do this is a urine provocation test. They actually give you a chelating agent, do a urine collection, you see how much comes out. And then you can treat it either IV or with pills, depending on what we find. So here's some more symptoms. Poor concentration, mood swings, emotional lability, so ups and downs, kind of bipolar-ish, poor memory, ADD, sleep disturbance. Again, probably most of your patients. And this particular entity in kids is associated with dizziness, poor concentration, impaired memory, personality change. Can be easily missed for ADD. Again, these are right from the EPA website for Lyme encephalopathy. So could you have a kid with ADD that actually has Lyme? Certainly. Lyme is a lot more prevalent than we think. Just last week, the EPA came out and said Lyme is probably 30 times more prevalent than they thought it was. It's very prevalent. It's hard to test for. A lot of places will just do an antibody screening test. It's not enough. It's often false negative. You may never see the target lesion. This is typically, tick bite is the usual vector. You'll get a red dot with a circle around it. That's, the standard pathognomonic Lyme tick bite. But often you don't see that. There's definitely Lyme in California, for sure. One of the first patients I saw when I came to the Ammon Clinic was a young kid who had gone down this disastrous route. He ended up at a sober living house for a few months here in Newport. He was from the Santa Barbara area. Started when he was 14. Normal kid, but he started to have difficulty at school, couldn't concentrate, had a lot of aches and pains. His mom thought he was lazy trying to avoid school. Teacher, he went to the doctor, couldn't find anything wrong, and he actually hurt. He didn't feel good. He couldn't get out of bed. He thought he was a slacker. So he started taking street drugs to feel better. I think Vicodin at first, that just progressed, gets him with the wrong crowd. Ends up using practically every drug known to man, IV, carotid artery injections of speed, etc. So his life, his whole, he was 21 when I saw him, his whole formative years are gone. He went down this gigantic drug path, missed school, he had Lyme disease. His mother actually found out about it. She read, I don't know how she got a hold of this list of symptoms associated with Lyme. She goes, oh my God, that's my son. And unfortunately, his life is dramatically different now than it could have been. So he is now being treated for Lyme, but still, that's a miss that you don't want to miss. And it happens very often. This is the kind of interesting part. It doesn't have to be a tick bite. The Lyme spirochete is actually seen in vaginal fluid and saliva. So could you get it sexually? You could. It hasn't really been documented transmission that way, but I think that's why it's a lot more epidemic than we think it is, because it can be transmitted that way. So if you happen to have an open lesion during sex, kissing, whatever, you're more likely to get it. More goodies. So, what do all these things have in common? They seem to be rather disparate, no connection with workplace injuries, traffic accidents, abnormal brain chemistry, reckless behavior, suicide, house pets, and schizophrenia. What could connect that? Working at Walmart, maybe. Toxoplasma. Toxoplasma, this is it. I don't want to get you freaked out here, but it will kind of freak you out. It freaked me out when I heard about it. Strong link to this infection and schizophrenia and bipolar disorder. Cats are the primary host. So this is why you don't want to scoop kitty litter when you're pregnant, because you can transmit toxoplasma to the fetus and it can cause blindness and a lot of other problems. So that's kind of well known, and that's kind of how I knew about it. Medically, it's cats have it. It's not cat scratch fever; it's different. But in utero exposure to schizophrenia later in life. So could that be why we get this 1% chronic schizophrenia percent of the population, historically forever? it's not uncommon. This is what blew me away. 60 million people, every third person you see has toxoplasma in their brain. 30% of the world is infected right now. In some parts of the world, 80% of them are infected. So it's very prevalent. Now, this is another really interesting study. Most of this is done at Johns Hopkins. They're kind of the center of toxoplasma research. So this is a study with mice. So they did mice that did not have toxoplasma infection and those that did. What they found, interestingly, was that the toxoplasma-infected mice had gluten antibodies, too. Toxoplasma is causing gluten sensitivity. And the babies of the mice have gluten antibodies. So could that be why so many people have problems with gluten? Turns out when you have toxoplasma, which a third of the population does, which means you also have gluten antibodies, and you eat pizza, bread, gluten, that combination is highly inflammatory. And you can see that in the brain. It shows up as an inflamed brain. So that's why so many people that have gluten feel terrible, can't think, may have psychiatric conditions. So one of our nutritionists, our main nutritionist in New York, Erica, she will put everybody on a gluten, dairy, sugar-free diet. Amazing results in some people. I mean, they come in with a list of 18 things wrong with them, and a month later, they're all gone. So it can be that dramatic. It really can be a big deal, and this may be why. So thyroid, hormones. We're going to switch over to hormones now from the scary bugs. This is a really big deal too. Thyroid is just so overwhelmingly missed. It's not funny, especially for people that have it. The Colorado thyroid study, they had 25,000 participants in this. It was a health study. And this was done in 2001, I think, with people with no, just random people that had health care. They were using very conservative measures of thyroid function, way beyond what I would consider to be normal. So even using these really bad numbers, they found that 10% of the entire population had low thyroid, including the ones already on medication. So that would be about 30 million people right now that are walking around with a low thyroid condition. Again, that's with really poor numbers, really conservative. So it's probably dramatically more than that. Even 40% of the people that were on medication were undertreated. And again, this is using bad numbers. So low thyroid. Thyroid is the master regulator of your entire metabolism. It runs there. It's like the gas pedal for your metabolism. So if you think of low thyroid, it means everything you have slows down. So your thinking slows down. You can have depression, certainly. You can have fatigue, certainly. Dry skin, hair loss, constipation. Everything just slowing down. So fatigue, depression, memory loss. We see a lot of depression, memory loss. Obviously, unexplained weight gain. So a lot of people will have difficulty losing weight, even if they're eating like a bird. They swear. And you're thinking, yeah, right, 20 But they really are eating like a bird. They really are eating well, and they just cannot lose the weight because their thyroid has been, metabolism has been damaged. So a lot of things, they're results of low thyroid function. And here's a reason why, a big reason why it's missed so often. It's the testing. And there are three main tests for thyroid. Unfortunately, just these two, TSH and T4 are usually only two looked for. That's not enough. It's not enough. And even then, the ranges are pretty broad. 0.45 to 4.5, so it's a pretty broad range. And like my first slide showed, optimization is the key. So you want the TSH, which has an inverse relationship with thyroid function. Basically, if it's high, your thyroid function is low. So you want this to be on the low side, meaning your thyroid function is high. You want your free thyroid hormone to be the upper third of normal. That's pretty much across the board with all hormones. They need to be in the upper third of normal. Would you rather run around with a third of a tank of energy or a full tank of energy? That's the best way to think about it. And that goes for pretty much all the hormones. So yeah, it's normal, but it's not optimal. And this is kind of more for docs, but in any case, there are other tests you can do to really look into this in depth. It goes much beyond standard testing. Why is this? There's two main kinds of thyroid hormone, T3 and T4. Your pituitary tells your thyroid what to do. It makes T4. Then T3 is the active hormone. That's what does all the work. They don't check that. They check these two. Unfortunately, I missed that. So what happens in states, which you'll see here in a minute, a lot of simple things can corrupt that whole mechanism. Instead of your body making T3, it makes a bad guy called reverse T3, which is anti-T3. It blocks the real hormone from working. And what can cause this to happen? A lot of things. If you diet, you have depression, anxiety, any kind of medical issue, poor diet, stress, on and on. All these things corrupt that mechanism for making active hormone. You know, who doesn't have something on this list, right? I mean, that's why it's such a rampant problem. And I think this is a real big environmental stuff. Plastics, fire retardants. You know, here in California, we protect smokers for some reason a lot. Everything has fire retardant in it. These chairs do, your carpets do, not carpets anymore. Your beds, pillows, cushions, all have fire retardant in them by law. Fire retardants are toxins to your endocrine glands, to your thyroid. So, you know, don't ever cook anything in plastic. Don't microwave anything in plastic. Plastic has phthalates, has BPA, and these are all thyroid toxins. So that's a big environmental issue we have causing these problems. If you have a low thyroid, often you're given T4, which is synthetic thyroid, synthroid, levothyroid. In some people, that's okay. If you are perfectly healthy, sitting on a beach watching the sunset with no problems, it'll work just fine. If you had any of those things I listed before, it may not work so well because of that conversion problem. So that's why natural thyroid, which has T3 and T4 in it, works so much better. People just do dramatically better when they have some real hormone on board. And some patients that are really bad, you need to give them T3 only. It's a little trickier to do that, but that will not convert into that bad guy, reverse T3. Estrogen, progesterone. Women can relate to this one. So, what happens normally through the month, progesterone and estrogen are always in a yin and yang battle. The first 2 weeks of the month, your estrogen is high, progesterone is low, then they switch, or they're supposed to switch. A lot of times, you don't get enough progesterone, you get what's called estrogen dominance, you get PMS. Now, when I say PMS, I don't just mean you're irritable and nobody wants to be around you. It can be anything that is bad that you don't like about your behavior or how you feel a week or two before your period. It could be worsening depression, worsening anxiety, worsening insomnia, more irritability. So I ask every female patient that's still menstruating, do any of your symptoms get worse? And very often the answer is yes. So that is PMS. It's a hormone-related problem. And that means hormones can't either eliminate it completely or get it dramatically better. And a lot of people will come to Amen clinics with anxiety problems, obviously, with attention problems, with depression. And it really is only that 2 weeks of the month. So you're better off with hormone balancing rather than Prozac. If they could just be like that first week, it'd be great. So, signs of low progesterone. Again, anxiety, depression, poor sleep, PMS for sure. Fibrocystic breasts can be pretty much cured with progesterone application. Headaches. So progesterone is like natural Valium. It's a calming for women. It's a calming neurotransmitter. It binds to your GABA receptors, which are the calming neurotransmitter. Levels drop when you have thyroid problems. Poor diet high in sugar lowers your progesterone level, so that can also be related to PMS. It protects against estrogen's effects in the body, which, when unchecked, can be a problem. Again, you can also you can eliminate PMS and PMS-related symptoms just by taking progesterone. The big T, so testosterone. This is for men and women. We all have the same hormones, just in different amounts. So men go through menopause. It's called andropause. It usually happens in your 40s, 50s. And this is also a big one to check for depressed patients. So if they have depression or anxiety or fatigue or all the above, testosterone can be great for men and women to treat their quote, mental illness. So you get loss of libido, fatigue, depression, loss of muscle mass, kind of like I lost my mojo. You know, I just don't want to do anything anymore. You know, I don't want to, there's no motivation. So replacement can reverse all of that. DHEA is an adrenal hormone. So this is another one associated with improved sense of well-being, improved immune function. It drops as you get older. Replacing it, it was replaced here in normal people that didn't have any medical issues, and they felt dramatically better physically and mentally. This is over-the-counter, one of the few over-the-counter hormones. But I wouldn't recommend taking it without checking your level first. So I just realized NAD, what they talked about earlier, is nutritionally assisted detox, which we're very interested in at the Amen clinics too. So I have actually set up an IV program at the Amen clinic for various things. So you can do amino acids for detox and rehab, neurotransmitter repair. We're actually going to start that soon. You can do the detox portion of it, literally to get off the drugs. Then you can also do a rehabilitation after through your detox. So if a patient has gone through traditional detox, they're pretty shot at the end. They've been through hell, and their brain isn't so healthy. And you can regenerate the neurotransmitters with a similar amino acid protocol afterwards. But there's also IVs to help calm down. There's this famous one called a Myers cocktail. High dose B vitamins, magnesium, instant relaxation. The benefit of IV is that you can do very high doses of nutrients that bypass your intestines. You can't take a lot of magnesium. Well, you do, you can get diarrhea. You can do huge amounts intravenously because you bypass the gut. There's also immune-enhancing IVs, vitamin C intravenously, used for cancer patients, chronic fatigue, immune system boosting, detoxification. Again, it bypasses the intestines, so you get very large doses you just can't do intravenously, orally. Hyperbaric oxygen. Yeah.
So what's the effect over a period of time once they get the IV therapy? That would trail, or?
Depends which IV, what they're getting it for. So if it's for Myers, for instance, you got a highly anxious patient, you get this intravenous drip of magnesium B vitamins, and instant relaxation. Takes the edge off right away. It's a very popular one. That's a temporary effect, but the point is you get these huge doses on board, especially magnesium, can actually get stored up in the system. So they can be done intermittently, they can be done in a short series, long course. Some people just have them on an as-needed basis. They'll come in for whatever they're doing. For chelation therapy is one. Hyperbaric oxygen, fantastic therapy for healing everything. This is not alternative. I mean, major hospitals, Hoag Hospital has a hyperbaric department. It's used for wound healing. But if you think about it, a stroke is a wound. A heart attack is a wound. A head trauma is a wound. So hyperbaric can heal many things. It's very popular with the autistic treatment community. Kids use hyperbaric all the time. Helps get them better. There's soft chambers, which you can even rent or use in your home, and giant ones that hold, a group. and the single place chambers as well. So really good therapy. Big fan of that. I've used it for years. So aim at clinics, why are we different than any place else psychiatry-wise? I think a lot of you folks already know this, but of course we use SPECT to look at the brain. SPECT is safe, it's reproducible, it's reliable. We can actually look in the brain and see what's going on. And there's various benefits. One of the biggest ones is the patients see it's their brain. It can take guilt off. I'm a bad person, I'm terrible, it's their brain. You see their brain is damaged, it's not a normal brain. It also helps spouses and other folks kind of accept them differently. So it measures blood flow in the brain, done lots of studies. So here's a normal looking brain. It should look like a brain. It's not an anatomical study. This is not an MRI. This is a blood flow study. So as you'll see, they can look very abnormal. This is normal. It looks like a normal, puffy brain. It's not normal. So this is a brain on cocaine. Those aren't really holes that are there. Those are blood flow areas that are dramatically reduced. So the brain, it looks like a normal brain in reality, but the blood flow isn't there. So again, it helps patients a lot because, especially drug users, everybody knows you're not supposed to do drugs. Everybody knows it's bad for you. Your mama told you don't do drugs. When you see your brain on drugs, it's different. Because now you're going, wow. So we show a normal brain, and then we show a brain on drugs, or their brain on drugs. And man, it can be a game changer. All of a sudden they get brain envy and want to have the good brain.
Does that really decrease the denial?
Yeah, no, it gets rid of the denial.
Gotta wait till it's
Yeah, they're like, oh, I can't deny it any longer. And I've actually seen that where patients said, on their intake form, no, it's been 6 months. They're upfront about it. Most of them. They'll say, oh, it was 6 months since I last used, and then we look at their scan, and it's like, how long ago was with you last month? So I met my girlfriend last night. She kind of did a little speedball. Oh, okay. I might have done it. And you can see improvement. So here's a brain that didn't look really healthy. Big holes here in the prefrontal cortex, which is associated with ADD, attention problems, a lot of other issues. And on medication, the scan gets better. So we can use the scan for diagnosis and follow-up treatment. Of course, you're using clinical judgment on follow-up. So why do people use? There's many reasons, as many of you know, why they use. A lot of people will use to calm their brain down. They have anxiety, depression. They use alcohol, opiates, painkillers, benzos. Or if their brain is damaged or they have ADD, they love stimulants because it makes them think better, feel better. So cocaine, methamphetamine, ecstasy, helps. Patients may resort to ecstasy or if they have depression. There's emotional reasons they use, so emotional trauma in their past, PTSD, obviously a big connection with substance abuse, men and women. To calm a damaged brain, so kindling is when the brain is kind of really lit up, and they're using to self-medicate, really what this is. Brain trauma also increases your risk of using drugs, and when you do, brain trauma itself causes increased risk, risky behavior, poor judgment, increases the risk of anxiety and depression, lower self-esteem, etc. You can see brain trauma on SPECT scan pretty readily. That's why we have an intensive questionnaire. It's something seemingly innocuous. The first question we ask is, did you ever have any head trauma? People are thinking, no, I never had a car accident. I was never knocked out. But then you look at the scan and you can see evidence of possible physical trauma to the brain. Well, did you ever fall off a ladder when you were a kid? Oh yeah, I remember riding my bike and hit a tree with my head, my helmet. I mean, little things, or just bonking your head on something, can lead to long-term behavioral changes because of the brain injury. It's really a super soft organ. It's the consistency of room temperature butter. It's super soft. So the skull is this hard, bony structure with sharp ridges in it, and you got butter sitting in it. So if you can imagine bonking that, the butter can get jostled and damaged pretty easily. And of course, there's genes. This is really coming to the forefront now. Family history, of course, all folks are aware that a lot of stuff, the fruit doesn't fall far from the tree, as they say. A lot of these problems can run in families. ADD, bipolar disorder, OCD. So genetics, in what you inherited, both predisposition behaviorally, but also how you metabolize drugs or don't metabolize drugs, also genetic. So what we say to patients, the real reason not to do drugs is because your brain is a mess. That's powerful. I mean, seeing the image really can be powerful for friends and family and the patient. So just to kind of summarize, my whole point here was just to kind of show you there's a lot of physiologic reasons you can have mental illness, I always use quotes, whatever it happens to be. It's ADD, schizophrenia, bipolar, manic. There can be physiologic, reversible causes, which you don't know if you don't look. So I try not to drug first, ask questions later. That really is the last resort. Now, some brains will be better on a medication for the rest of their life. You can't deny that. It does happen, but that should be kind of the last resort. And again, this whole biomedical approach, I think, is really the future of psychiatry and the mental health industry. Industry, unfortunately. So we're using intravenous therapies, hormones, diet, the whole milieu of biology is what we explore there. And I think for patients, especially the folks that you're seeing that have gone through the ringer, a lot of people end up here because they're self-medicated. And looking for those causes can really lead to lifelong cures.
Does the SPECT analysis, is that covered in regular medical benefits, or is this mainly private pay or what?
Yes, AMIN is all private pay. SPECT is not an AMIN development, but it's not used for mental health. That's what Daniel's been saying forever, is we need to start doing that. We need to start applying science and imaging to mental health. So it's not used, unfortunately, not enough. There's also fMRI, functional MRI, which is a lot sexier than SPECT. SPECT has been around for a long time. It's nothing new. fMRI is the new darling of radiologists, but SPECT is really kind of better for what we do. Any other questions?
Can you say some more about Candida? Is that
Yeah, Candida. I'm just going to check. I got it. So Candida is a yeast. We all have a little bit in our system. You don't want a lot. Yeast feeds on sugar. So if you have a high sugar diet, you're feeding your yeast. And the Candida produces, all these bad guys produce toxins. They produce neuroactive substances. So they actually change your brain chemistry. A lot of your brain chemicals are made in your intestines. So serotonin is made in your gut, transported to your brain. That's why there's really a gut-brain connection. When they say, I have a gut feeling about something, butterflies in your stomach when you're nervous, there really is a connection there, literally, physiologically. So if there's a problem in your gut, you have a problem in your brain. So Candida can cause fuzzy thinking. Typically, you can't concentrate, lack of concentration, poor concentration, memory problems, irritability. One of the signs of having it is if you bloat after meals, especially after carbohydrates, because the yeast produce gas. That's what ferments beer and everything. Is different kinds of yeast. So very prevalent. Standard blood test, you can even look for it. The way to get rid of it, stop eating sugar. You got to turn the fire off, the gas to the fire. You can take prescription or natural antifungals to get rid of it. If people are really bad, I'll usually give them a prescription antifungal followed by natural. So you got to change the diet. There's a Candida diet, basically just don't eat sugar. So it can be found. It's fairly simple, fairly easy to find. I will do the stool test to see exactly what kind is there, because some of them are really resistant to antifungal medication. But it really is a lot bigger deal than people think. Most physicians do not recognize it at all. So if you go to your doctor and say, I think I have a candida problem, they're going to laugh at you. They only think candida exists in vaginal infections and AIDS patients. So AIDS patients get candidiasis, which is systemic candida yeast overgrowth, because their immune system doesn't work anymore. We're not talking about that. We're talking about an overgrowth in the gut that's releasing junk into your system. So again, that's just where these fields diverge dramatically. Western medicine is pathology-based. Diseases, okay? Not optimization, not quality of life, not chronic illness. So that's why the boat is missed so often on these things. They're just not looking in the right areas.
I just have a question with the candida thing.
Mm-hmm.
You know how there are those cleanses out there?
Yeah.
So do they really work? Or
It depends on what kind they are, what they include. Some of them will include natural antifungal. There's a lot of herbs that help get rid of candida.
Mm-hmm.
So those are okay.
Okay.
But it kind of depends on how much you have, what kind it is. So it's okay to do that. It may not be enough, but again, you gotta get rid of the sugar. And definitely want to take probiotics. So there's a few good probiotics that I use for cleansing. One of them is called True Flora. That's a good one. Also Culturelle, which you can find at Mother's, or even pharmacies have Culturelle. It's a special version of strain of lactobacillus. It's great for cleansing candida. Even one box worth can help you get rid of it. So probiotic, getting rid of the bad guys and flushing it with good guys.
Since this is a kind of a departure from the DSM, are you anticipating or expecting any kind of resistance or pushback from that culture?
Pushback. Daniel's been fighting that forever. But again, once the director of the NIMH comes out and says the DSM is bogus, well, we love that. And it's really true. I'm not been a fan of DSM. We don't even use a DSM at AIM and have it for years. Just because it's just symptom clusters. That's how you do that. So, the whole field is moving away from DSM and into more biological medicine.
Does plain yogurt help with the natural bacteria in the stomach? And when
Not
you say
so much.
albacore tuna, is other tuna okay, or just albacore?
Albacore seems to be the worst. Again, the bigger the fish, the bigger the problem. So, because the fish don't make mercury, they eat smaller fish. And so the bigger fish that have eaten a lot of smaller fish, they accumulate. So that's why smaller fish aren't as bad. Bigger, giant swordfish, tuna, shark that have eaten a lot of little fish, they accumulate more. So,
And plain yogurt is...
plain yogurt, not so good. But those bacteria don't really stick that well. There are probiotics in there, cultures, which is fine, but it's not really kind of sticks to your gut well.
what would be a natural source of probiotics?
A source?
Source, yeah.
So Culturelle, that's one, health food stores have it. Oh, a natural source.
Food source for...
Well, fermented foods are actually really good. So sauerkraut, for instance, kimchi, all those fermented foods have a lot of good enzymes in them, a lot of good bacteria. But really, it's best to take
How do you handle a situation when someone comes in and says, oh, my wife is borderline personality disorder, and then they come at you with that and say, this is the reason why blah, blah, blah has happened in my life. So it sounds like since the DSM is not used primarily, how would you just have that conversation with them without invalidating them?
Well, we don't say that they're not borderline.
Okay.
We're just saying we don't say depression doesn't exist or bipolar doesn't exist. We kind of use those broad categories. But is it a 661.3 versus a 661? We don't break it down like that. And in any case, you're still going to treat the patient to get them better. So whatever their symptoms happen to be, there's not that many psych drugs to use. There's not that many different kinds of drugs. So you're kind of limited anyway, and you're treating what we know will get them better. So while we're not saying drugs don't work or that bipolar doesn't exist, certainly those categories exist. And a borderline personality disorder is still a personality problem that can be helped. So that's what people will come in and they'll often ask, well, I've been told I have OCD, someone else said I had ADD, someone else said I had PTSD, which one do I really have? And we get that a lot. And they come to the Amen Clinic because they've been to everybody else. And in reality, it doesn't really matter what your label is. We're going to go with what's wrong with you, what do you want to get better, and what's going to work the best to get you there. So the label part is helpful sometimes, but it can also be damaging and pigeonholes people. So we try to shy away from labels. All right, thanks, folks. I gotta run.